Hi, Martin here from Align Chiropractic, and today's video is a follow-along video, so you can follow along as I run you through a series of exercises. And today's video is really about moving and soothing lower back and hips and sacroiliac joints. So when we're taking care of people in the practice in this sort of area, there's kind of a hierarchy that we work through to help people's bodies work at their best. And that is, we want to restore movement to the joints first, because if the joints aren't moving, then it tends to create increased stress and strain on everything else. Lack of movement also affects the alignment, and if the movement and the alignment of the joints is not the way that it should, it causes changes in the firing patterns of the nerves, which then affects the muscles, which then affects the ability of your spine to sort of balance overall, and affects the stability of how that whole system, in a lot of ways, the way your whole body works. So we're going to kind of work through a sequence where we're going to start making sure, while it's not as good as getting an adjustment, which is often the only way to kind of get each of the segments working, we can use movements of our body to maximize the amount of movement we've got with our spine. We want to make sure we've got everything moving nicely first, and then we're going to move into improving the alignment so that we can then translate that into having things working as stably as possible. And then often your body will have held on to some muscle tension from things not working properly. We're going to run through a few releases that you can do to help things feel as comfortable as possible. So we're going to start off with some lateral flexion movements. Lateral flexion is a really important movement in the way that our spine works, because the coupled motion of the spine means that if you've got lateral flexion, kind of every other movement will perform better. So we're going to just slide right hand all the way down your right leg, just reaching to a point. We're not really wanting to force this, just getting to a point where we feel a point of tension, and then we're going to go through a count of 3 there. 1, 2, 3. And then we're going to come all the way up, go all the way over the other side. We're going to go through this sequence 5 times each way. 1, 2, 3. So that's our first. And go the same thing over this way. 1, 2, 3. And over to the left. This is our second one. 1, 2, 3. That's number 2. 1. Oh, went a bit early. 1, 2, 3. There's a lot of counting going on here. This is our third time over here. 1, 2, 3. That's our third time. 1, 2, 3. So 4th time. 1, 2, 3. Last one. All of this should be nice and gentle. 2, 3. Really just wanting to get each of the vertebrae moving as much as they can. 1, 2, 3. Okay. So next we're going to move flexion and extension. It's a bit of a bias towards really wanting extension as much as possible, because so many of our activities, whether we're sitting or bending forward, encourage flexion, and so a little bit of a bias towards encouraging extension. So we're going to start off with extension, so hands on the lower, on your hips here, and then we're just bending back. This one you just want to be a little bit careful that you're not jamming things. So we're not going super far into this one, just to a point of a degree of tension, and then holding. 1, 2, 3. And then from there we're going to go into flexion. Going to be nice and gentle here. If your back's feeling a little bit tight, then just stop at the first point of tension. It's fine to just have your hands on your legs there. But if you're feeling free, then we're just going to go as far forward as we can. In this case, fingers touching the ground. 1, 2, 3. And then we're going to come all the way out, nice and slowly. Coming back into extension, hand on the lower back. 1, 2, 2, 3. Same thing, coming forward, just nice and easy, just dropping from the hips. 1, 2, 3. So that's our second time through. We're going to come back here. 1, 2, 3. All the way forward for our third in this sequence of 5. 1, 2, 3. 4, 1, 2, 3. Nice and easy coming forward. 1, 2, 3. Last one. All the way back. 1, 2, 3. And last one forward. 1, 2, 3. So for the next part, what we want to do is increase the amount of rotation that we have with our lower back. A couple of different ways that you can do this, but I'm going to pick an easy way. So what I'm going to have you do is, if you're able to get your foot over sort of at the level of the other knee, then that's ideal. If that's not comfortable, then you can end up just with the leg down like that, but ideally we want up like this, so we're then using our leg as a bit of a lever. So with this one, we're going to incorporate a little bit more breathing. So this time I'm going to get you to breathe in through your nose and then out through your mouth. And we're just going to hold, rather than rotating back and forward, we're just going to hold in a rotated position for 3 breaths. So we're going to come all the way around. I'm just hooking my elbow onto my knee. Other hand goes around like this way. So I'm getting a nice rotational stretch, and then just increase a little bit if I'm able to. That's 2. So we can get a little bit more. So that one just little point of performance there. We're not wanting this sort of position, we're wanting a more upright stretch. So stretch comes through our back. So nice 3 breaths there, and then we're going to swap legs there, and we're going to stretch the opposite way. So leg over, and then this way. Get that rotational twist in there. 1. And out. In through the nose. And out. And in through the nose. Okay, so from there, we've got some rotational movement. Now we want to get some movement through the sacroiliac joints. So they're the pelvic joints, the joints right at the very bottom. What we want to, their plane of movement is more, rather than this sort of plane, they twist forward and backward a little bit this way. So best way of working with them is we want to pop one foot right out in front, the other, we're basically going into a long lunge here, and so back leg there. So really important that this front knee is behind our front foot, and we're wanting to get this knee back nice and long. And then what I'm going to have here is I'm going to reach my hands in on the inside of my hips there. So it's a bit of a hip flexor stretch, as well as mobilising sacroiliac joints. So from this position, I'm just going to hold here and breathe in through my nose and out through my mouth. Just dropping a bit further in with each breath. And out. that's 3 for that side. Just going to swap positions here. Pop that leg forward, this leg back. Keep my hands on the inside. If that's too much, then you can do more or less the same thing from this position, but ideally we want to really encourage a lot of movement into those sacroiliac joints, because when we're sitting, they're not getting much movement at all. So breathe in through the nose. And out. Breathe in. And out. Breathe in. And out. Okay, just gently come out of that. Okay, so we've got some movement now through both the spinal joints, the lumbar spinal joints, and the sacroiliac joints. So what I want to move on to now is an exercise to just help in terms of our postural alignment. Got everything moving. Let's do an exercise that'll kind of offset that tendency towards flexion, to slumping forward that many of us have just from hours spent sitting. And so what I'm going to show you now is an exercise called a Superman exercise. It's a really great exercise both in terms of encouraging better posture in your spine, also can translate into some improvements in stability. So really simple exercise. You lie face down, arms in that classic sort of Superman position. And what we're wanting to do here is just quite simply start off quite low, lift up, hold, 1, 2, 3. Relax, that's 1 repetition. 1, 2, 3, that's 2. 1, 2, 3, that's 3. 1, 2, 3, that's 4. 1, 2, 3, that's 5. Making sure to just sort of pinch your shoulder blades back as well. Just get better posture through the middle back as well. 1, 2, 3, 6. 1, 2, 3, 7. 1, 2, 3. 1, 2, 3, it's 9. 1, 2, 3, that's 10. Okay, so movement and alignment taken care of. Now we want to just see if we can get rid of and release some of the tension that builds up. Biggest focus of tension, or the biggest driver of tension tends to be tension in the glute muscles, so we're going to focus on that for this sequence. You can use a lacrosse ball or a tennis ball, a cricket ball, a spiky ball, a foam roller. This is a little short one. Same thing works with the bigger roller. For today, I'm just going to use the spiky ball, but any of these work. So to start with, we're going to go on our side, and we're going to work this big fleshy part on the side here called your gluteus medius. What you're aiming for here is, if you reach down, you've got the side, you hit that top of your hip bone, what's called your iliac crest, and there's a fleshy bit between that and the next part of your hip called your greater trochanter. And so what we're doing here is we're going to lie on our side with that there. Just find a tender spot, and then we're going to hold that tender spot while we breathe. So you notice I'm slightly backward of exactly on my side. Your tender spot could be slightly forward or back of there. And then from there, I'm just going to breathe in through my nose. Deep breath, and then one more deep breath while I'm at that full point. And then out. We're going to repeat that 3 times. One more double breath. So that's gluteus medius released. And that type of breathing also helps to get us relaxed, or in what's technically called a parasympathetic or rest and repair state. So now where we're aiming for is a muscle called the piriformis muscle, which is kind of in this fleshy part, like right where the pocket of a pair of pants might be. And we can either just put the thing on the floor and go straight on there. If you want to increase it a little bit more, you can pop that ankle of the right leg onto the knee of the left, find that tender spot, and then we're just holding pressure there, and we're going to do double breaths again. Let's just let that relax into it. Last one. That's it. So now I'm going to flip over to the other side. Find my mic cord there. And again, we're going to start with the gluteus medius. So come onto that side and find that tender spot. That's the one right there. So breathe in through the nose. Breathe in. Third breath. So that's just release that gluteus medius. So now again, going for the piriformis. Don't have a pocket on this side, but imagine where a pocket would be. I'll pop my ball there. And just that leg straight. This one like that, or if that's too much, just like that, works fine as well. I'm going to find that tender spot. Oof, yeah, that's the one. A bit more on this side than the other side. So I'm going to breathe in. Again. It's the second one. Go for the third one. Perfect. So there we have it. Sequence to move, improve the alignment, and then soothe and release the muscle tension there. Thanks for watching.